This episode is brought to you by Nordstrom. Spring calls for a wardrobe refresh, and Nordstrom has the best styles of the season. From dresses and denim to standout tops and accessories, find the trends and essentials that feel right for you. Discover new arrivals from brands you love like Wave, Princess Polly, Mango, Adidas, and Free People. Plus, free shipping and returns and free styling appointments make everything so easy. Shop in stores at Nordstrom.com or download the Nordstrom app.
With Plan B emergency contraception, we're in control of our future. It's backup birth control you take after unprotected sex that helps prevent pregnancy before it starts. It works by temporarily delaying ovulation, and it won't impact your future fertility. Plan B is available in all 50 U.S. states at all major retailers near you with no ID, prescription, or age requirement needed. Together, we've got this. Follow Plan B on Insta at Plan B One Step to learn more. Use as directed.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hi, everyone. I'm excited to have another guest here today. Would you be able to introduce yourself for us and tell us a little bit about your background?
Yes. Hello, everybody. I am Dr. Thompson. I am originally from Columbus, Ohio. I went to the Ohio State University College of Dentistry for dental school. I graduated in 2024, and then when I graduated, I moved to Florida, and I now practice as a public health dentist in Florida.
How did you go from Ohio to Florida? What set your sights on moving to warmer weather?
Yeah, so it's funny. I actually went to the University of South Florida, which is in Tampa, for undergrad. And so when I was in high school, I knew I always wanted to leave Ohio. And so I figured undergrad was the best time to do it. And so I just applied. I applied all over. I applied California, North Carolina, Florida, and I ended up touring my undergrad USF and loved it. So I knew I was going to go there. And then when I got in, I went, absolutely loved it. And from the time I started dental school, I told everybody I'm going back to Florida. And so I ended up, once I graduated, I was able to find a job down here and just moved back.
For job search, I mean, obviously you might have had some connections from undergrad and everything, but what was it like applying for jobs at a whole nother part of the country when you were up in Ohio for dental school?
Yeah, so it was actually really hard, and I really didn't have too many dental connections here. I had one dentist that I shadowed in undergrad because I actually did a gap year. So I did my gap year in Columbus. And so I really didn't have too many dental connects down here. So I really just was kind of winging it. I used Indeed. I kind of looked around here. I asked that dentist, but she was in a different area than I'm in. And so she didn't really have anybody that she knew that she could connect me to. But ironically, I ended up finding my job from one of my mentor dentists in Columbus. Her daughter worked at my practice. And so she connected me to their dental director. And that's basically how I was able to get the job, because I looked on Indeed and that wasn't really kind of turning into anything. And then, I interviewed with corporate places and different options like that. And then I was able to find this job in public health through that dentist in Columbus. So yeah, it was kind of hard because you're not really there. And I feel like had I stayed in Columbus, it would look very different. Maybe I wouldn't necessarily be in public health. I could have been in private practice or other things, just because when you're in dental school, you know that area well, and you shadow there, and you also do rotations and stuff there. So the connections looked a little bit different. So I honestly struggled. I was looking probably September of 2023 up until I got my job in March of 2024. So it was kind of hard.
And I mean, it's also you can't visit offices as easily. It was probably oh, I can try to come on spring break or winter break or something. Did you have that experience? If you got any interviews, were you just going during school breaks, or did it not even really work out that way?
Yeah, luckily, I think I had a good majority of graduation requirements completed. And so I kind of went a Friday to Sunday type of thing. Or when I interviewed here, I think I took maybe a day off from school and just had to do an absence request and come down here interview and then like fly back. I was literally going like a couple weekends at a time. I think I came down here 3 times interviewing at different places. But it was kind of hard. I just had to find like times and breaks in my schedule, or like spring break. I think I came down here, and then those 2 other times were just like random breaks in the schedule.
It's really well I've heard from people that are trying to move to other states that they really only found their jobs through like a random personal recommendation, because I think it's hard if you're not from dental schools they're familiar with and you haven't done a residency. It's a pretty big chance that they're taking on an associate that's fresh out of school. Did you get that feedback with some of your interviewing that they wanted to see more experience first?
Yes, I think that a lot of times with private practice, they wanted a lot of dentists who had more experiences, like placing implants or like, more surgical experience than I feel like a lot of new grads had, especially new grads that they don't know. I think it's a little bit different. Like, I know a lot of my friends that I graduated dental school with, they found private practices, but they knew those dentists or had like family connections. So yeah, I do think that a lot of the times, or even just like the job postings, a lot of times people wanted somebody with more experience. And so it was really kind of challenging and almost like defeating a little bit, because you didn't even know if you should apply for it because you didn't know what they were going to say. So I always just applied. And then if they didn't want me, I just wouldn't hear back. Or they would say, oh, I'm looking for, an associate who can do this. Can you do these things? Or like more molar endo was a big one too. Like, and I can do some molar endo, but I feel like a lot of times you don't have the repetition that a lot of practice owners want fresh out of school. And so that's why it tends to be a lot of times when you're moving states, corporate or like public health tend to be the routes, it seems like.
So did you graduate in May 24 or 23?
May 24.
Okay, so same as me then. We're the same graduation year. Nice.
Yeah.
So tell me a little more about the group you're working with now. You said it's public health. What does that look like?
Yeah, so I'm at a Medicaid practice right now, meaning that about 90%, I would say, of our patients are Medicaid patients. And so we accept anywhere from PPO plans, anything like that. Like we have Delta Dental, Ambetter, and then we also have majority Medicaid, but we also see sliding scale patients. And so if they don't have an insurance, then they can kind of qualify for a different sliding fee scale. And so I currently work 5 days a week, Monday through Friday, 8 to 5. I am 4 days in pediatric dentistry. So I work at our pediatric clinic Monday, Tuesday, Thursday, Friday, and then Wednesday I'm at our adult clinic. So that's kind of how it works. But majority patients, we see like restorative. So we do fillings, crowns, SSCs for the kids, standard like treatment, exams, cleanings, all of that. And then we also have emergency appointments or like same day walk-in limited appointments that we see for all of those patients as well.
When you imagine owning a practice someday, you're probably thinking about patients, not paperwork. But there is that part that we don't always discuss in dental school, the business side of dentistry. That's where Link AI for ADAC Plus comes in. Think of Link AI as behind-the-scenes assistance that works with your practice management software, helping with scheduling, payments, forms, and patient questions. It pulls text, calls, and emails into one inbox, replies automatically, and can even book appointments and keep a communication history so nothing slips through the cracks. And if you have ADAC Plus and compatible ADAC delivery systems, Link AI enables real-time messages from the front desk to the operatory. So stay focused on your patients and tap the link in my show notes for more info and a free 6-month trial. Available in the US only. And would you say the pace of when you're at the pediatric focused office, is it kind of the stereotypical pediatric where it's like a lot more patients, quicker appointments, more patients in a day than your Wednesday with the adults?
Yeah, it definitely is. I think that, like, I'm even thinking today, like today was very, very busy because our kids are on spring break now. So everybody's coming in for their appointments, which is good, but it's definitely higher volume, quicker pace, like you said. So typically how our schedule works out is we are kind of blocked out 16 patients in a day, 8 in the morning, 8 in the afternoon, and that's typically a restorative appointment. So filling or extraction, sometimes it can be crown and bridge, sometimes stainless steel crowns, just kind of depends on the schedule. And then everything at our clinic is separated. So they would come for a separate appointment for their exams, their cleanings, their treatment. Everything is separated. And so I would always, per 1 hour block, I will have a restorative appointment, a exam appointment, and then typically we have a third column. And so the third column is like quicker things. So sealants, SDF, different things like that. And like I said, they will add emergency appointments on throughout the day. That's just kind of how our schedule ends up working. So we're seeing like 16 patients in a day if everybody shows up, no shows. And typically we have less no shows at the pediatric clinic than we have at the adult clinic. But I would say on average at the pediatric clinic, I will probably see anywhere from 18 to 30 patients in a day. And then at the adult clinic, it really can range there, but I'm only there one day, so I do kind of stuff my third column just so I can get my patients back. So I will typically be anywhere from like 15 to 20 over there.
And I think we talked about this a little bit on TikTok, but other people wouldn't know. So you started off initially a little bit more even spread between the pediatric and the adult clinic, right? When did you transition to more of the pediatric days?
So it was actually the opposite. I started fully in pediatrics.
Okay.
Because when I started, there was 4 other new grad doctors that started at the same time as me. And we had 4 other doctors who have been at that practice. And so when I started, me and one other girl started the same day, one other doctor, and we started the same day. And so they ended up splitting us based off where our mentor doctor was. It was really nice because they set us up with a mentor doctor that just helped us like learn the clinic, like just basically take everything in if we had any questions or anything like that, since we're new grads. So it's nice to be able to have like a direct contact at that clinic. And so my mentor doctor was actually in the pediatric clinic. And so I kind of just started over there. And then the other new grad doctor, she started in the adult clinic. And so for 6 months, we were only over there. And then 6 months after is when we started the rotation. And so all of the doctors just ended up getting different days. And so the way it worked out was that I got 1 day, and then the other new grad doctors that are there have 2 days at the adult clinic. So yeah, that's kind of how it worked out. So I did start almost 100% pediatrics, which was scary at first because in dental school, we didn't really get a ton of pediatric experience. I think for us, we had maybe like a 2-week pediatric rotation, and that's when we were doing like exams, cleanings, x-rays, sealants. Maybe if you were lucky, you got a filling during that time. And then we had dental coach bus. So that was like, we would take our like bus out to different schools and we would do treatment over there. And that was maybe 2 weeks as well. So I maybe had like a total of a month of pediatric experience, just because Ohio State has the pediatric rotation or the pediatric residency program with Nationwide. So a lot of those cases are getting deferred over to the residents. So I had no idea. Like the first time I did a stainless steel crown and pulpotomy was at my job. So it was kind of nerve-wracking, but honestly, as those 6 months were going on, I really started to enjoy the pediatric office, and I just felt like I was building very like strong connections with my parents and with my patients, and nothing felt like more rewarding than seeing a patient through their treatment, and they start really nervous. And then, by the time you do a couple fillings on them, they're good and they're happy and they like coming there and they trust you. The parent trusts you. And so I almost didn't want them to give me a day over at the adult clinic because I was like, I don't want to leave my patients or anything like that. And so it ended up working out. But yeah, it was definitely an interesting transition.
Yeah, I feel you on that. At Michigan,
We had similar, a couple of weeks of peds, but it wasn't any restorative work. It was just like exams and sealants and things. And then on our like public health rotations, there would be some kids sometimes, but so I probably saw like 10 kids for fillings before I like worked in the real world. So it's strange because I feel like a lot of dentistry as a general dentist is like family care, and there's absolutely kids. So I wish that we got a little more exposure during school, but somehow it all works out in the end.
You kind of figure it out as you're going. But it's interesting though, because I think schools do differ because we have the LECOM dental students actually that rotate through our clinics. And so they get a lot of peds experience. They have, I think, a pediatric day every week. And so, or like 1 to 2 days every week. So they're getting a lot of peds experience, but then you have to think too, LECOM doesn't have the residency programs like Ohio State, like Michigan has. And so, you know, we're all just trying to figure it out. So.
And I'm also curious to know, as you're talking about working with kids, for some people, maybe if they're fresh out of school or maybe they don't see a lot of kids, that makes them scared. What are your tips for working with kids, making it fun, making them not have a bad experience? What would you give advice for people?
Yeah, I think pediatrics a lot of the times is kind of tricky because it is a lot of behavior management. And so I think just like being how you are with other people's kids if you don't have kids is kind of always how I am. Like, I think I'm just a very like fun, like outgoing, like bubbly person naturally. And I think that that kind of like is like kids kind of respond well to that. And so just using different like distraction techniques, like I'll tell them, you know, like, tell me about your favorite thing to do at school. And a lot of people will say like recess or lunch, you know, and kind of playing off of that, or like little jokes, or like, it's kind of hard too, because I have to like keep up with the things that the kids are talking about, like K-pop Demon Hunters or Slayers, whatever that, I haven't even watched it, but I try to like, you know, or like Paw Patrol for the little ones. You know, the princesses are always a popular thing. So just kind of getting them to like relax a little bit, because I think the dentist can be a very scary environment for kids. And so getting them talking about their favorite things, talking about their favorite colors. For me, I like to wear bright colored scrubs, and, you know, maybe that seems a little more scary than somebody who is, or a little less scary than somebody who's coming in with like, you know, white coat, black scrubs, you know, things like that. You just, I don't know. That's just kind of how I do it.
What's your routine for getting the kids numb? Do you have any tactics that you use?
So I over explain, I would say, and I kind of show them with my finger first. So I kind of explain, tell, show, do everything. I will put we use topical, so I will put the topical on there. I'm like, okay, it's gonna taste really spicy. You know, it's gonna start to feel like everything's falling asleep there. Like when you sit on your hands, it's falling asleep. And then I got like patient sunglasses for them, and so I'll try to have either the assistant or like myself. I'll try to cover the eyes a little bit so they're not looking, of course, hide the needle and everything. And then I'm just like, okay, focus on wiggling my cheek here. I'm just going to put your tooth to sleep. I'm going to use the sleepy juice, and we're just going to put a little there. And then as soon as I'm getting ready to put the anesthetic in, then I wiggle really quickly and then slow down and put it. And typically that's fine. But a lot of times, you know, kids are going to be looking every which way, and you know, I'm telling them, okay, look up at the sky, close your eyes, you know, think about your favorite movie. What ice cream are you going to eat after that? I think just trying to distract them as they're doing it, and then after, they're fine. But that can definitely be the most challenging part. And we don't have nitrous at my clinic. So it's all about the distraction techniques. But it's typically sleepy juice, mosquito bites. You know, it's like when you sit on your hand, your gums, your tooth are just going to sleep, so it won't hurt when we're doing the treatment. So
yeah, I found that's like the make or break point of the appointment. Like you need to be able to do that well and efficiently, and without them knowing too much of what's going on. Then from there, it's like so easy. But those have been the times when I was first starting out working where I just like lost the kid. If you just did not do the anesthesia well, or they either saw too much or they felt too much, then you just it's done from there, because they're just freaking out.
And then I do have some kids that like, you know, they get through the anesthetic and then they realize like what's happening. And then sometimes we lose them that way. But I do feel like, yeah, the anesthetic is the hardest part. So sometimes I will have the parents stay in the room if that seems like a part that they are like really nervous about. But parents in the room in pediatrics is kind of like, you know, an interesting, I feel like, take, because some providers would prefer them not being in the room. Some providers prefer them being in the room. Depends on the clinic that you're in. But I do find most often than not, the kid will do better when the parent is in the room, at least for the anesthetic part. So, you know, I just kind of do anything that I can do to get them to not know what's happening. And then also just saying, oh, it's not going to hurt. It's not going to hurt. Or you might just feel a little pinch and I'll like tap their shoulder or tap their arm and be like, oh, this is what it feels like. You feel it when I'm poking here. That's the same thing that's happening. It's just happening up here. So, yeah.
And also curious, how often are you finding that you guys are referring out to pediatrics? Like kids are not cooperative enough for you to get work done there?
Yeah, this is interesting. I think it's hard to give a number because I feel like in a given day, most of the times I can get the patients to cooperate. I will also tend to give them a second chance before I refer out for nitrous. If they have like full dental work that they need, then we will send them to GA. As long as they have Medicaid, it's covered 100%. So I'll send them to general anesthesia. But for nitrous, I typically try about 2 times. And then if they can't get it after that first or second time, then I will refer to nitrous. But honestly, it is very hard for our patients to find pediatric providers in this area that accepts the Medicaid and can do the treatment for them. And so that's why I tend to be a little bit more, patient with the kid, because I know how challenging it is for my parents to find a provider in the area that will accept the Medicaid and do the nitrous sedation. So I do give them a lot more chances than I think, maybe other practices do, just because I kind of understand the access to care and all of that, and transportation sometimes is a thing. But I would say maybe in a week, I would maybe have 2 to 3 patients that I'm referring for nitrous. But most of the time, if we're referring, it's going to be for GA.
And for us, at least in Michigan, I work in a pretty rural area too. So same kind of thing. There's not a lot of people that take the kids' Medicaid, which is tough to see. Yeah. But also if they do need the general anesthesia, the wait is so long. We have like one person that does it, and it's like, It's so long. I don't know. Do you experience that too, that if you are referring them, they're expected to have a while till they'll actually get in?
So actually, the company that we work with that does the sedation actually has been getting the kids in pretty quickly. I think I had a patient that I saw like a week ago, and they're getting in and they already did their consult. They did their consult the next week, and they have their surgery scheduled the week after this week. So
that's great.
Yeah, they've actually been pretty quick, but it's mainly like our patients and some LECOM patients, and I think maybe one other clinic refers to them. So it's less like volume for them versus like a hospital setting, or like, Ohio State had Nationwide. And so a lot of people are going to Nationwide for the surgery. So honestly, we are very lucky with that, where they're able to get them in pretty quickly within a month or 2 to get the treatment done.
And you've been out as long as I have out of school. It seems like you really like your job. Did you have any idea as a dental student that this is what your working as a dentist would look like?
No, honestly. I feel like it's hard as a dental student to imagine what life outside of dental school is going to look like, because I think just like growing up, shadowing and all of that, I think that like you just think you're going to graduate, you're going to be out of practice, you're going to be working. But in terms of what that looks like or how you get there, I feel like I never would have predicted that I would be here. I know that I've always had an interest in public health, and even in dental school, all of our rotations that we did throughout like public health places, I absolutely loved. And I just knew that I kind of had a calling for that, at least at this point in my life. So it is kind of nice, especially now that we have the LECOM students, just to talk to them about like, you know, what life is like outside of dental school, because you don't really get a lot of that in dental school. You go from seeing 2 to 3 patients in a day. Maybe you saw more on rotations, to now I'm seeing like 20 people in a day. And if you would have told me that beginning of D4, I would have been like, I don't know how I'm supposed to see all those people. But it is definitely a transition at first. But I think like just as, you know, the high achieving individuals that we are as dental students, I think that that transition, you know, is pretty natural and seamless. And so I am grateful that, you know, I have found a position that I do really enjoy, even if it was like not at all what I was expecting, because I didn't really ever have an interest in pediatrics. Like even though like when I started working, like my very first job, I was teaching kids how to swim at the YMCA. And so I've always been drawn to like pediatrics. I've always enjoyed working with kids, but I don't know, the dentistry aspect of it always seemed very like intimidating to me. And so in dental school, I never would have imagined that I was going to be working with peds the majority of the time, and the fact that I do really enjoy it. So it's interesting. I think you just have to be open to all different experiences, and like what life looks like outside of dental school may not always be what you expect, but maybe it's kind of like what you need at that time.
And looking back on your journey, it could be whether since you graduated as now working, or if it was during dental school or during your gap year, what is something that sticks out as a challenge that you've encountered in this dental journey that you feel like is worth mentioning for people, how you worked through it?
Yeah, I think the challenge is kind of navigating, you know, different personalities that you kind of come across, whether, you know, in pediatrics, you're navigating the personality of the kid, the personality of the parent, the personality maybe of like dental assistants, office managers. You know, there's a lot of different, you know, behaviors and personalities that in a day that you are kind of navigating through. And so I think that that can kind of be an interesting challenge, but I think just like staying true to yourself and who you are and how you show up, and like also not being afraid to like ask for help, or luckily we have like pretty good administration at my, you know, office. If I ever needed anything, I could go to my dental director, I could go to my office manager and talk to them, or even like other providers, you know. So I think that balancing all of that, because, you know, when patients come in, they're already terrified of the dentist, and you're having to navigate that barrier, but then also just navigating treatment and like understanding, like as a new grad, it's not always a cut and dry situation, whether it's behavior, whether it's, you know, the tooth, or, you know, the treatment that you're doing. It's never cut and dry, which is why I think a lot of us like dentistry, because there is so much gray area, but then also like being comfortable understanding that like every day in dentistry looks different. Every tooth looks different. Every person looks different. Every personality is different. And so it's definitely, you know, hard to navigate it at first and can be challenging, but I feel like that's what's something that always kind of drew me to dentistry, was the fact that we do get to interact with so many different types of people. We are getting to, you know, navigate so many different relationships with patients, with, you know, staff, offices, specialists. And so kind of just taking that day by day has been the best for me.
Mm-hmm. And I feel like there's some different perceptions of Medicaid clinics, like working in one. Is it going to burn you out? Is it good? Is it bad? And I mean, we talked about access to care a little bit and how important public health is. Mm-hmm. But in your experience, would you recommend people consider the different groups that mainly treat Medicaid patients as a job out of school?
I definitely think it has been a wonderful job, first job especially, because I think it's as similar to dental school as you're going to get, just because we're used to working in these populations. So it's very, I didn't feel like it was new. Like I didn't feel like everything was brand new. Just getting like the volume of the patients that you're seeing. But, every Medicaid practice is different. And even from pediatrics to our adult clinic, that looks a little different too. But I am so grateful that I did this because it almost feels like a residency, like a GPR or an AEGD, because they are a lot more flexible with you and a lot more patient with you, especially as a new provider. And so I feel like this is like the best opportunity to have right out of dental school, where you can just focus on the dentistry and not have to worry about all of the other things that come with being an associate, being a practice owner. Public health is a wonderful option, especially if you're just looking to try to fine tune your dentistry and like really get more reps in.
And when you say public health, if you're willing to share, are you like salaried then and benefits and PTO? That's when I hear public health compared to working in like a private clinic. Is that your style?
Yes. So our practice is salary based. So all of the doctors are salary, and it's kind of a set salary once you sign your contract. There's no really fluctuating with that. So we see the same, no matter how many patients we see. If we see 3 patients that day, if we see the full 16, if we see 25, if we see 8, we get the same pay every day regardless, no matter what the treatment is. And so I feel like especially starting off, that is really nice and kind of like a comfort blanket that you have where you don't have to worry about production and how much you're producing. And because that was something that was kind of scary to me because I didn't really understand how all of that worked, especially being someone who doesn't have any dentists in their family. I didn't really know how all of that was going to work. And I just really kind of wanted to focus on the dentistry the first couple years. But yeah, so I get PTO, we have vacation, sick time, we have continuing education time. So it's kind of nice because, a lot of practices, associates don't have like paid time off. And, there is very drastic, pay differences within Medicaid, but I think you can pretty much find a practice that pays relatively well, even, with you being salary, but then you also consider the benefits that you get. We get health insurance, we get dental insurance, vision insurance, like all of that, disability, all of that. And then they reimburse a lot of things for us as well, like our ADA membership, our license, CPR, all of that gets reimbursed for us. So it's definitely nice.
That's super nice. Yeah. I mean, that's contrast to being in a private office with me. It's you get a % of what you produce and it is what it is. If you don't show up to work because you're on vacation, you don't get paid. If you're sick, you don't get paid. You pay for your own health insurance, all your own everything. Yeah. And that's how it is for a lot of people. So especially coming out of school, I can see it being a lot easier to just focus on, like you said, building your dental skills, not having any type of potential conflict of, do I need to diagnose more crowns or this or that? Like that just doesn't come into it. You just focus on the dentistry and the patients that you're with. You don't have to worry about the money really.
Yeah. Yeah. And I think it's nice. I think obviously like over time, maybe like one is going to outweigh the other, but I think in the beginning, it all ends up being about like average. And just because I feel comfortable saying like I am about average for like what a general dentist will make in the state of Florida. And so, like I said, Medicaid can pay pretty well. And it's different amongst the states too. So it's really nice kind of having all those other things that I was worried about because I'm like, I have contacts that I wear every day. Like, how am I going to get that covered? Or, just like if you're sick and you need to go to the doctor's, health insurance. And a lot of, I was seeing on TikTok, actually, a lot of like dentists don't have their own dental insurance. And so, all of that kind of played into the decision as well. It's like nice to, while we're starting off, not have to worry about all those other things. And then later on in life, if I decide to, switch to something or be an associate, I eventually maybe want to own a practice, considering all those things. But at the beginning, it's a really nice first job.
And kind of talking about the fact that now you're out of school, you have some stable money. What is life like in terms of
your finances, having more flexibility to do what you want. I mean, you're busy working 5 days a week, but how is life on the other side of dental school? How are you managing doing all the things you want to do?
Yeah, I think it's so fun after dental school because, you can come home and actually relax. Like, I like to, work out and hang out with friends, see family, and it's nice not having to think about like tests in the back of your mind or like boards or needing to study for anything or like calling your patients, things like that. Like, it's really nice to have that balance. It's been nice too having like your own money where you're not thinking about like, of course you have other finances and things, I'm trying to save for a house and, different things like that. But it is nice feeling a little bit more free. And then making like money because you spent all this time, up until this point paying for school or living like, loan payment to loan payment or, different things like that. And so it's nice because you have that flexibility now and it's a little bit more free. Of course, you have other things, you still have to pay your loans and, other bills and things, but it feels a lot nicer to be able to like travel and enjoy it and, do different things, see different, things or experience different things that you didn't, necessarily get the chance to experience in dental school. So it has been the best. And I always tell our students, I'm like, life after dental school is so good. You guys just keep powering along. You're going to get there and you're going to be so happy and so grateful that you did.
I know, literally. It's like, just keep pushing through. Like it's great. I think it's great. I don't know. Maybe some people aren't happy and every day, some days are hard. I think we both got back from work today and I was like, I just need to push this back 10 minutes. I need to like reset for a second and then we can log on again. So like, it's not like every day's perfect, but like, it's exactly what you wanted, at least in my case. I'm like, this is what I worked for.
Right. And you worked so long and so hard that now you get to like enjoy the fruits of your labor. Like even if you had a difficult case that day, you get to go home, reset, and then, enjoy the things you like to do, spend time with, partners or anything like that, family. My favorite thing to do when I come home is literally to just sit and be mute because I spend all day talking and, being like outgoing and bubbly. And so it's nice to just have time to just like decompress from the day. So
you gave a lot of good advice earlier about working with kids and also like navigating the different personalities that we do from team members to patients. But do you have any other kind of closing advice you'd want to give for fellow young dentists?
Yeah, I would say that just be true to yourself and then also like understand that it is a roller coaster ride of emotions, of experiences. You're not going to know everything at first, straight off of the bat. So it's nice being able to have people that you can kind of talk to. I talk to my friends from dental school all the time. We'll share, experiences and stuff like that because, we're all like bonded for life. And, just be patient. It's a learning experience. Every day looks different, but then just kind of understanding that you're really just out here doing the best that you can and trying to help your patients, and just enjoy the ride because every day you're learning something new and just enjoy it and know that, you've worked so hard. Like we said before, you worked so hard to get to this point and you're doing good. So that's what I would say. Just be confident in your skills and your abilities. Know that dental school prepared you to be a great practicing dentist. And just like everything in life, it takes time, it takes experience, it takes practice. So be patient with yourself, trust yourself, and just enjoy it as much as you can.
And if people want to stay connected with you, where is your TikTok page?
Yeah, so my TikTok is Nikkia Thompson DDS, and I think there's an underscore in there, but if you just search my name, Nikkia Thompson, it should pop up. I actually used to do YouTube, so I used to watch you on YouTube, actually.
Oh my gosh.
Yeah, and so maybe we need to bring that back, but definitely definitely TikTok and Instagram. You can find me on there. Yeah.
Awesome. Thank you so much for your time today.
Yeah, thank you for having me. It was so fun.